The exact cause of sweet syndrome isn't always known. In some people, it's triggered in by infection, illness, or certain medication. Sweet syndrome can also occur with some type of cancer. The most obvious signs of sweet syndrome is a deceptive skin lesion that usually develop according in this. A small series of bumps appear suddenly on your arm, neck, back, and a few or upper respiratory infections. The bumps grow quickly in size, spreading in clusters called plaque that may be up in an inch or so in diameter. Lesions may persist for weeks or months and then disappear on their own without medication. With medication treatment, you're likely to be free of skin lesion in just a few days. Other signs of the symptoms of the sweet syndrome include moderate to high fever, pink eye, or sores in the eye, tiredness, ancient joint aches, and mouth ulcers. The causes are, although sweet syndrome may be associated with infections and condition itself, sweet syndrome is typically divided into three categories, depending on the assumptions. In most cases, the sweet syndrome isn't known. Sweet syndromes affect women between the ages of 30 and 50, and is often preceding an upper respiratory infection. It's also been associated with pregnancies and inflammatory bowel disease. Migratory association. In about 20% of these cases, sweet syndrome is associated with cancer, most often acute leukemia. A few cases may be associated with the solid tumor, such as breast or colon cancer. Sweet syndrome often can occur when the early signs of cancer after being diagnosed as a sign of a reoccurrence. Fevers are often presented in the skin lesions typically aren't produced by the upper respiratory infection, as in the case of the epidemic sweet syndrome. Sweet syndrome appears to affect men and women equally, but among older adults, and is most likely to occur in women. Treatment for the drugs. Left untreated, sweet syndrome not associated with the serious conditions may disappear on its own within the time of 3 months. Medication can improve the skin lesion and